The most dangerous fat in your body sits wrapped around your liver and pancreas, where you can't see it or feel it. It's called visceral fat, and it's what drives diabetes, heart disease, fatty liver, and even cancer in your 60s. You can be 20 pounds overweight and have almost none of it. You can be skinny on the outside and be full of it, and the scale will lie to you about both. The good news is that visceral fat is the easiest fat in your body to lose once you target it the right way. In this video, I'll show you the foods that burn it off, the one drink that breaks it down faster than anything else, and the 45-minute weekly habit that cut visceral fat by almost half in 2 months in a published Mayo Clinic study. Let me define visceral fat properly, because the difference between this and the soft fat on your belly is the difference between an inconvenience and a heart attack. The fat you can pinch between your fingers above your belly button is called subcutaneous fat. Subcutaneous, meaning under the skin. That fat is mostly cosmetic. It does not love you, but it does not actively hurt you either. Visceral fat is the fat that sits deeper. It packs in between and around your liver, your pancreas, your intestines, and your heart. Those organs were never designed to be insulated in fat. When fat tissue grows around them, it does not sit there quietly. It behaves like its own organ. It pumps inflammatory chemicals called cytokines into your bloodstream every minute of every day. Those cytokines damage your insulin receptors, raise your blood pressure, scar your liver, and irritate the lining of your coronary arteries. 15 years of practice. The thinnest patient I have ever diagnosed with fatty liver disease weighed 128 pounds. The largest patient I have ever cleared with healthy metabolic markers weighed 232. The scale lied about both of them. What it could not see was where their fat was sitting. Stay with me. By the end of this video, you will know the 4 things your body responds to fastest when the goal is removing visceral fat specifically. And you will know a 30-second self-test you can do tonight with a piece of string. Let me tell you about someone I will call Margaret. 64 years old, retired teacher, lives in a small town outside Cincinnati. She came in for what she thought was a routine annual physical. Her BMI was 22. She walked her dog every morning. She had not been more than 10 pounds over her wedding weight her entire life. Her blood work came back with a fasting glucose of 116, a fatty liver enzyme panel double the normal limit, and a hemoglobin A1C just under the diabetic line. We sent her for an abdominal scan, and the radiologist measured her visceral fat area at 145 square centimeters. Anything over 100 is considered metabolically dangerous. Anything over 130 puts you in the same cardiovascular risk bracket as someone 70 pounds heavier. Margaret had no idea. Her clothes still fit. The scale at home still showed the same number it had shown for 30 years. And inside her belly, her liver was being squeezed by a fat layer she could not see, could not feel, and had never been warned about. A standard physical will not catch this. The doctor measures weight. The doctor measures blood pressure. There are 12 minutes in that appointment, and no one is taking a tape measure to your waist, let alone ordering imaging that would actually show what is happening inside the abdomen. Margaret is not unusual. The Cleveland Clinic estimates that roughly 25% of normal weight adults over 60 have what is called metabolically obese normal weight. Metabolically obese meaning the body is behaving as if it were obese on the inside. There scales them, they are fine. The mirror agrees. The doctor, working off those 2 data points, signs off on it too. Let me be direct with you. Visceral fat is the only fat you actually need to be afraid of after 60. Your subcutaneous fat is at worst a clothing problem. Visceral fat is a heart attack and a fatty liver, and a diabetes diagnosis sitting in your abdomen waiting to be named. Before I tell you what to do about it, I want to give you a way to actually measure where you stand tonight. Get a piece of string, anything you can hold against your body without it stretching too much. You are going to measure your waist circumference, which the WHO and Cleveland Clinic both say is a better predictor of visceral fat than weight or BMI. Stand up. Find your hip bone on the side, the bony part that sticks out above your pelvis. Place the string just above that, around the level of your belly button, and wrap it all the way around. Mark the spot where the string meets itself. That is your waist measurement. Now measure your height, the same string, top of your head to the floor. The number you want is your waist divided by your height. If your waist is more than half your height, you have too much visceral fat. Below half, and you are in the clean zone, regardless of what the scale says. The cutoff has a name, the 0.5 rule, or the waist-to-height ratio. Multiple peer-reviewed papers in the Journal of the American Heart Association have shown it predicts heart attack, stroke, and type 2 diabetes better than BMI, body weight, and waist size on their own. Run the numbers with me. A 5'4" woman, that is 64 inches. Half of that is 32 inches. If your waist is 33, you are over the line regardless of your weight on the scale. A 5'10" man, that is 70 inches. Half is 35. A 36-inch waist on that man means visceral fat is already crowding his organs, regardless of how much he weighs. This is the only home test that maps to what actually shows up on the abdominal scans we order in the clinic. Do it tonight. Write the number down. It will be the baseline for every change you make over the next 8 weeks. Stay with me through the next 2 sections, because once you know your number, the foods and the drink and the exercise dose I'm going to give you become the precise protocol that pulls that number back down week by week. Start with food. What you eat every day either feeds your visceral fat or starves it. And there is a category of foods that does the second job better than anything else in the produce aisle: carotenoids. These are the plant pigments that give carrots their orange, tomatoes their red, sweet potatoes their warm color, and dark leafy greens their deep green. The name comes from carrots, where they were first discovered, but they show up across the colorful side of the produce aisle. You already know vegetables are good for you. What you may not know is what carotenoids specifically do at the cellular level inside abdominal fat tissue, and the published trial that proves it. A randomized, double-blind trial out of Japan, published in the British Journal of Nutrition in 2018, took adults with elevated visceral fat and randomized them into 4 groups. Each group ate a specific carotenoid-rich vegetable mix every day for 8 weeks. Every single group lost visceral fat. The strongest effect was in the group eating high lycopene foods, which are mostly red: tomatoes, watermelon, pink grapefruit. 8 weeks, measurable reduction on abdominal scans. The mechanism is 2-step. First, carotenoids are powerful antioxidants. Antioxidants neutralize what are called free radicals, which are unstable molecules produced by your fat tissue when it is overloaded. Free radicals cause inflammation, and they damage the genes that control how your body decides whether to store or burn fat. When carotenoids neutralize free radicals, that genetic damage stops. Second, and this is the part that genuinely impressed me when I first read it, carotenoids appear to actively switch on the genes inside fat cells that increase fat burning and switch off the genes that tell your body to store more fat. The Cleveland Clinic has documented this pathway in detail. It is called nutrigenomics, the study of how specific food compounds talk to your DNA. Carotenoids are one of the cleanest examples we have. Color is what to look for on your grocery list. Every meal, ask yourself if there is a real color on the plate. Beige and white are warning signs. Carrots, bell peppers, tomatoes, sweet potatoes, dark leafy greens, butternut squash, kale, spinach, romaine, mango, papaya. Any colorful vegetable or fruit is loaded with at least one carotenoid family, and the trial shows it does not matter which one you favor. All 4 arms of that Japanese study lost visceral fat, a practical target. 6 servings of colorful produce a day for 8 weeks. A serving is roughly 1 cup raw or half a cup cooked. That is the dose that produced the measurable result. Less than that, and you are heading in the right direction, but you will not see the kind of imaging-confirmed change those patients saw. So, the drink. I want you to understand why I'm calling this out separately from food. Most of what people drink is metabolically neutral. Water is necessary. Black coffee is fine. Most herbal teas do nothing for visceral fat one way or the other. But green tea, when you drink it consistently, is one of the few beverages that has been measured to reduce visceral fat by itself, independent of what you eat that day. So, if this is the level of detail you wish your own appointment offered, the simplest way to keep it coming is to hit subscribe. The next video in this series covers a single morning drink that an NIH-funded trial showed lowers fasting blood sugar more reliably than most over-the-counter supplements on the market. And it pairs directly with the green tea protocol I'm about to give you. Anyway, the compound responsible for green tea's effect on visceral fat is called catechin. Catechins are a class of polyphenols, which is a fancy word for a plant compound that acts as an antioxidant. Green tea is unusually rich in them because of how it is processed, which is barely at all. Black tea is fermented, and fermentation breaks down most of the catechins. Green tea is steamed and dried, and the catechins survive. A 2009 trial out of Japan, published in the Journal of Nutrition, gave one group of adults catechin-enriched green tea, providing about 600 milligrams of catechins per day. The other group got regular tea with about 90 milligrams. After 12 weeks, the high catechin group lost significantly more visceral fat on abdominal CT imaging than the control group. The difference was clearly measurable on the scan. The mechanism is 3 things working together. Catechins boost what is called fat oxidation, which is the metabolic process your body uses to break stored fat back into energy. They raise the rate at which your body chooses fat over sugar as a fuel source during ordinary daily activity. Catechins also inhibit lipase, a fat processing enzyme in your gut. So, a portion of the fat you eat alongside the tea is blocked from absorption in the first place. And green tea contains caffeine, which combines with catechins to amplify the fat-burning signal. To get the dose used in the trial, you are drinking 3 to 4 cups of high-quality green tea a day. The catechin concentration depends on the type. Matcha is the highest, sencha is next. Standard bagged green tea is lower, but still effective if you steep it properly. Steep for 2 to 3 minutes in water just under a boil. Boiling water destroys some of the catechin content. A note for the people on blood pressure medications or blood thinners. Green tea can interact with both. 3 to 4 cups a day is fine for most people, but if you are on warfarin or a beta blocker, ask your doctor before you change your intake. The interaction is mild, but it is real. I want to pause and remind you what this video is paying off. Visceral fat is the only fat that actually matters for your long-term health after 60. The foods and the drink we just covered will get the process started. The lever that pulls visceral fat down faster than anything else is the next one. Exercise. And the dose that works is more specific than most people realize. A 2021 meta-analysis in the International Journal of Behavioral Nutrition and Physical Activity pulled 117 randomized controlled trials of diet, exercise, and combined interventions. For overall body weight loss, diet wins. For visceral fat specifically, exercise wins, even when the calorie deficit is identical. That is a finding worth sitting with. 2 people in the same calorie deficit, one cutting calories from the kitchen, one creating the deficit through movement, will lose roughly the same amount of total weight. The one creating deficit through movement will lose more visceral fat in a higher proportion almost every time. The reason is that exercise does things to your metabolism that food restriction does not replicate. Moving your body raises your insulin sensitivity, which directly pulls fat out of visceral storage. It activates a class of fat called brown adipose tissue, which burns calories instead of storing them. And it lowers cortisol, the stress hormone, which is the single biggest driver of visceral fat storage in adults over 50. This is a hard piece of news for the patient who is dieting religiously and seeing the scale move, but feeling no better. I see this every month. The scale shows progress. The blood work does not. The waist does not. They are losing the wrong fat. The other finding from that meta-analysis is dose dependence. With diet, calorie restriction hits a ceiling. Beyond a certain deficit, you do not get a proportionally larger drop in visceral fat. With exercise, the relationship is mostly linear. More minutes, more intensity, more visceral fat lost. The British Journal of Sports Medicine confirmed this with a 2022 review showing that participants who exercised more frequently or at higher intensity saw proportionally greater visceral fat reductions on imaging. The takeaway for your grocery list and your calendar: the grocery list matters, and it is doing real work. The calendar matters more. The hours you mark off for cardio are doing something for your visceral fat that the salad bowl cannot. This is the protocol from the trial that should be on a billboard in every cardiology clinic. A study originally published in Medicine and Science in Sports and Exercise, referenced in multiple Mayo Clinic and Cleveland Clinic reviews since, took middle-aged adults with abdominal obesity and put them on a strikingly simple regimen. 2 cycling sessions per week, 45 minutes each, at 75% of their V2 peak, which I will translate in a second. After 2 months, abdominal scans showed a 48% reduction in visceral fat. Insulin sensitivity improved by 41%. Subcutaneous fat dropped 18%. Their body weight on the scale barely moved. 2 months, twice a week, 90 minutes total of effort per week, and almost half of the fat around their organs was gone. V2 peak is the maximum amount of oxygen your body can use during exercise. 75% of that is the moderate to vigorous zone. Translated for someone who does not own a heart rate monitor, it is the intensity where you can still get a sentence out, but you sound a little winded doing it. If you can sing along to the radio, you are below that zone. If you cannot get 3 words out without a breath, you are above it. The sweet spot is somewhere in between. The exercise does not have to be cycling. The meta-analyses I have referenced compared running, cycling, rowing, swimming, brisk walking with incline, dancing, and aerobic group fitness classes. The differences between modalities were not statistically significant. The variable that mattered was intensity and duration. 45 minutes at moderate to vigorous intensity twice a week was the dose that produced the result. Margaret, the 64-year-old I told you about earlier, walked. She walked uphill at her local park twice a week for 45 minutes. She wore an inexpensive heart rate strap to stay in her target zone. On top of her existing diet, she added 2 short carotenoid-rich meals and a daily green tea. 6 months later, her fasting glucose was 92. The fatty liver enzymes were normal. Her A1C had dropped under the pre-diabetic line, and her abdominal scan showed her visceral fat area down from 145 to 88 square centimeters, well below the metabolically dangerous threshold. Her bathroom scale showed she had lost 4 pounds, and she had reversed pre-diabetes, healed her liver, and pulled her cardiovascular risk back down to baseline. The scale, again, was the worst indicator of what was actually happening inside her body. That is the payoff of this video. Visceral fat responds to a specific protocol faster than any other fat in your body. Carotenoid-rich food, catechin-rich green tea, 2 45-minute cardio sessions per week at the talk test intensity. 8 weeks is enough to show measurable change on imaging. 6 months is enough to reverse the metabolic conditions visceral fat causes. One more piece before I give you the list. There are 3 habits, none of them diet and none of them exercise, that are multiplying or dividing the work you are doing on visceral fat every week. If you ignore them, you will see half the result for double the effort. Sleep first. There is a consistent finding across NIH-funded sleep research over the last 15 years. Adults sleeping less than 6 hours a night have measurably more visceral fat than adults sleeping 7 to 9. The mechanism runs through cortisol again. When you are sleep deprived, your cortisol pattern flattens through the day and rises at night, which is the exact hormonal environment that tells your body to park fat in your abdomen. Aim for 7 hours minimum. If you're getting 5 or 6, fixing that is mechanically equivalent to adding another cardio session per week. Alcohol second. This is the one nobody wants to hear. Alcohol is the single most efficient food in your kitchen for producing visceral fat. The liver processes alcohol before everything else, which means whatever else you ate that night gets routed straight into storage. Storage means abdominal storage in adults over 50. 2 drinks a night every night can produce more visceral fat over a year than an extra 600 calories of food per day. The Cleveland Clinic has been explicit about this in its fatty liver guidance. If visceral fat is your target, alcohol is the first thing to drop, before anything else on this list. Stress, third. Chronic stress raises your cortisol. Cortisol tells your body to store visceral fat as an emergency reserve. This is measurable. A 2018 paper out of Yale, published in Obesity, tracked cortisol levels in abdominal CT scans in adults over a year and found that participants with the highest chronic cortisol had the most visceral fat independent of diet and exercise. Whatever you use to lower your daily stress, prayer, a walk without your phone, a regular call with your sister, a slow morning, that counts as a visceral fat intervention. 5 things. Do them this week. 1. The string test. Wrap a piece of string around your waist. Measure it against your height. If your waist is more than half your height, you have measurable visceral fat. Write the number down. This is your baseline. 2. Color on every plate. Carrots, peppers, tomatoes, spinach, sweet potato, kale, butternut squash. 6 servings of colorful produce a day. Hold this for at least 8 weeks. The carotenoids do the work. 3 cups of green tea a day. Matcha or sencha if you can. Steep just under boiling 2 to 3 minutes. The catechins block fat absorption and accelerate fat oxidation. 4. Twice a week, 45 minutes of moderate to vigorous cardio. Walking uphill, brisk biking, dancing, swimming, your choice. Target the talk test intensity. Breathing harder than rest, but still able to speak in short sentences. Twice a week for 8 weeks is the dose that worked in the trial. 5. 7 hours of sleep, alcohol minimized, and 1 daily ritual that genuinely lowers your stress. These 3 are the multipliers. They will double the effect of the first 4. Do this for 8 weeks. Take the string measurement again. If you have not lost an inch off your waist, you are doing one of these wrong, and we will diagnose it together in a future video. Everything I just gave you sits inside a larger picture, which is that the most important fat in your body is the fat you cannot see, and the most reliable way to find it is a tape measure. There is one related test that is far more powerful than the string measurement, and far cheaper than the imaging we order in the clinic. It is a single blood marker that is included on most routine labs, but almost never explained to the patient. Most people over 60 have it on their last report, and have no idea what the number means. In the next video, I will show you exactly what that marker is, what range you need to stay inside after age 60, and what to ask your doctor to add to your next blood draw if it is not already there. Click the card on the screen to watch it now.